Welcome back. We're talking with Kimberly Gardner from Intermountain and Tricia Ayers from Chaudere about mental and behavioral health in children and adolescents. Thanks again for both of you being here. Now, Tricia, I want to go to you. So it seems like we hear a lot about mental health issues, more so than we used to. Can you tell us why that is?
Well, I think for our state of Montana in 2018, we had the highest suicide rate in the nation. And so I think that we have spent a lot of time and energy as a community of Montana, really trying to address that mental health crisis that our children and our families are in. So I think we're just openly talking about it more. I think we're having those conversations. People are more comfortable bringing it up with their kids. It's talked a lot about in schools with kids early on. And so I think people are just finding a comfort level in discussing a really difficult topic. Nationally, I think, before Kimberly mentioned the Adverse Childhood Experiences study, and I think that's really brought to the forefront the impact of childhood trauma and how it can really affect a person across their lifetime. And so I just think it's something that we are all aware of nationally. We know the effects, we have the research now, and so people are really looking at assessing it earlier on and starting those conversations early.
And so following with that, can you tell us, basically what causes mental illness in children?
Well, there isn't any one specific thing you can say that causes mental illness or mental disorders in children and in families. I think it's a lot of things. We talk a lot about risk factors. So, there's a lot of different risk factors that might increase the probability that you might develop a mental disorder, but that doesn't mean that that's going to happen. There are also protective factors that come into play culturally within families that can decrease the risk of a child really developing a disorder if all of those risk factors are met. And so, it's a combination of things. It's biological, it's, within your family, if you have a family history. Culturally, there are components that can contribute to that, as well as issues within the community. So it's a wide variety of things that contribute to that.
Okay, great. Kimberly, I want to come to you and talk about the challenges of kids getting treatment. There's a lot of them. Can you kind of explain some of those challenges and what you do at Intermountain that addresses those needs?
Sure. I think it's very complex. As Tricia said, there are many factors that inform families or inform communities about what kids and teens and families need. And so part of the barriers or the difficulties have to do with stigma, for one. So I think there's a lot of misperceptions in our communities and families about what are the underpinnings of mental illness or addiction and what does it look like in children. So if children are exposed to adults who are primarily coping with managing their life distress with alcohol or substances, then that limits the ability for that youngster to develop some healthy life coping skills. Also, there is a shortage of providers, and it's sometimes very difficult to find a provider or therapist or psychiatrist that is trained in adolescent and child brain development and what the impact of certain life experiences have on that child and on that family. So while some things are identified, it can be difficult to connect exactly to the right type of provider. And so we're hoping that telehealth opportunities in the state and recruiting efforts are going to help make more services available, especially to those folks that are in more remote areas or where there is a serious lack of providers that are available to them. We're also working very hard with schools and communities to create trauma-informed cultures and trauma-responsive cultures in schools and support them in recognizing or identifying screening early so that we can recognize when a youngster or family needs support before a major mental illness is developed. And also working with communities to develop Elevate Montana affiliates, which is a movement across the state to infuse communities with ACE trainings and trauma-informed, trauma-responsive services, but also resiliency factors. What do families and kids need that are good buffers and good prevention efforts to prevent mental illness? So we're doing that across all areas and also partnering with wherever children are. So we have school-based mental health programs so that the youngsters can get treatment there at the school and the parents don't have to take time away from their work and the kids miss school. We're also partnering with some community health clinics where parents will take their children for primary or dental care, and we have a specially trained child and adolescent therapist in those sites. We've also partnered with the East Helena School District to create a school clinic that combines all of those partners together and makes for quick access. And we're partnering with our local hospital here at St. Peter's Health to have a child and adolescent trained mental health therapist on the pediatric unit for those kids who are placed there because of psychiatric crisis and are in need of acute care. Okay. So we're trying to provide integrated behavioral health and partner with other providers that are like-minded that will create more opportunities and more points of access for kids and families.
You know, and you mentioned stigma
Yes.
when you were talking in that last answer, and I wanted to follow up on that a little bit.
Sure.
What is the stigma issue from your perspective, and how is your organization working to deal with that?
Sure. Well, stigma comes in many forms. Sometimes it comes through media, sometimes it's within a family culture. So, for example, if a family has had a negative experience with mental health, or they have some significant family problems related to mental health or substance use, they might be reluctant to have a youngster screened or to recommend treatment or seek treatment because they could be concerned about the cost, or they might be concerned about having family issues disclosed and they're already feeling overwhelmed. What we're seeing with teens is hopeful for me, is that they're showing a lot more tolerance and acceptance of each other.
Awesome.
And that gives us a lot of hope. They're integrating and helping each other. But when stigma rises up in an adolescent group, they tend to be very harsh with each other, and social media has just really made that quick access to be able to bully or to harm a child and each other. So I think it's widespread, multifaceted.
Okay, great. Well, I want to thank both of you for sharing your perspectives. It's been a great conversation, and thank you both for being here.
You're welcome.
Thank you.
I'd also like to thank Page 2, and we'll see you all next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.